Hello and welcome to this Bloomberg Businessweek Town Hall on mental health in the time of COVID-19. There's a national pandemic, and it's not the one you think. I'm Joel Weber, the editor of Bloomberg Businessweek, shameless plug. Joining me is my colleague, Cynthia Koons, a senior reporter for Bloomberg News, who's one of the very best health journalists around. Cynthia, thanks for joining me.
Thanks for having me, Joel. This is going to be a great opportunity. We're hoping to hear from all of you in the live audience about the things that you want to learn about mental health right now, ways to access care, issues you're dealing with when you need care. Feel free to treat this as an open forum for you to ask whatever you need to really get to the heart of what's going on here and how people can access care in this time of social isolation.
That's right. Cynthia, you've written a ton about mental health for the magazine over the last year, including a recent article about the challenges facing the system because of the coronavirus, which obviously helped inspire today's discussion. I want you to know I also put on a collar for the first time in a couple of weeks from working at home. I've been wearing t-shirts, so it's nice to actually, feel like I'm doing real work today. We also have some great guests that will be joining us, and I'm really excited to engage with them on this important topic because they're just really big names in this mental health space. First of all, we're going to have Dr. Winsberg of Brightside, where she's the chief medical officer. Also, Dr. Neil Leibowitz of Talkspace, he's the chief medical officer there. And we also have Dr. Duckworth, chief medical officer for the National Alliance on Mental Illness, and Dr. Christine Moutier, Chief Medical Officer for the American Foundation for Suicide Prevention. This is the first time we've been doing a town hall like this, so please just bear with us if we encounter any technical difficulties. But in general, we're going to divide the program into 3 20-minute sessions. In the first block, we'll talk about how the telehealth platforms are meeting this moment with our first 2 guests. Then we'll change gears and switch to how people are being affected by the mental health crisis with our other 2 guests. And then we'll bring everybody back together for the last 20 minutes where we'll be able to ask a bunch of your questions. That happens to be one of the best features to this format. It's basically interactive. If you have a question you'd like to ask any of our guests, please just type it into the comments and we'll do our very best to field as many as we can when we get to that point in the program. Now, without further ado, let's get started with our first 2 guests, Dr. Winsberg and Dr. Neil Leibowitz. Neil, thank you so much for joining us.
Thank you for having me.
Thanks so much for having us.
Excited to talk about this important issue with both of you. Telehealth. In 3 weeks, telemedicine has gone from being something that people probably weren't using to suddenly it is the only game in town, right? And I'm curious, what kind of spike in demand you're seeing, Neil, for you first? And how is your platform rising to meet this moment?
We've seen an incredibly large, unfortunate spike in demand. It's been, at this point, over 65%, and it's people coming looking for therapy. We've seen demand in a lot of different ways, though. So in addition to people seeking therapy, we've done some work to open some free Facebook groups, Instagram, where for people who need a little bit of a lighter touch, can really get help. And we've seen huge demand numbering in the thousands there as well. So overall, it's really been a flood.
And Mimi, how about for you at Brightside?
Yeah, I think I can echo some of those sentiments. We've seen about a 50% increase in our first quarter, which was largely reflected in the month of March as this started to escalate. And last week was probably our busiest week ever, I think, as sort of the immediate needs of people are getting met, like making sure they have a good place to shelter and taking care of food. Now people are beginning to start to address mental health concerns that are arising as a result of this crisis. And so we've seen a big spike in the last week as well.
Which is normal, right? Here I am self-isolating with my family, and anxieties, everything feels like something that just feels like it's settling in a way that, most of us probably aren't used to. Like there's a certain amount of social interaction we're used to, and now we're sort of being deprived of that. What are sort of the first things that people are reaching out and asking for help about?
Well, I think, I'm not sure if you directed that question to me, but I think one of the things that's really clear is that our brains sort of hum along as predictive engines. We're constantly scanning the environment, thinking about our past and trying to predict what the future is going to look like. And we do this unconsciously. We do this all the time about everything in our life.
Part of being human, right? Yeah.
That's how our brains work. It's how we function in the world. And right now, that process has gotten upended because we're not able to make the usual predictions that we can about the future. Everything feels uncertain. Everything from what's going to happen to next week with our jobs, the economy, to are we going to be healthy, to, is our usual park going to be open, to will our grocery store be open? So it's everything is sort of uncertain right now. And what that does is it creates a lot of uncertainty and then a lot of fear and then ultimately a lot of anxiety.
So what would you say to people who are dealing with some of this anxiety that is sort of part and parcel of living through this? When is it time to seek help versus when is it, okay, we're all living in crisis and this is a pretty normal way to feel when you know, like you said, where you're going to get your groceries from next week?
So as mental health professionals and as psychiatrists, we do this based on really people's symptoms and the severity of those symptoms. And I would say and also the notion of how much those symptoms are interfering with our daily lives. So interfering with our ability to get through our social functions and our work. I think the best way to find out if you really need help at this point is just to take an assessment. If you go to our landing page at brightside.com, you can take a free assessment and we'll give you your results right away that will help put in perspective how much your symptoms are interfering right now and how severe they are. So we can actually scale them on a mild, moderate, severe level and then make recommendations based on that. But we tend as medical professionals to think about these things in terms of symptoms and then interference with our ability to function in life.
Neil, I know that you at Talkspace offered free therapy for frontline medical providers who are working with COVID patients who have very intense demands on their work and personal life at the moment. Wondering what the utilization of that has been thus far and the response from that community in terms of their need for mental health services.
So, as you mentioned, it's been really a wonderful experience, just emotionally. We started with 1,000 months. We opened it up to the therapists on our network who donated an additional 300 months, which we matched. And then Michael Phelps recently donated an additional 500 months, bringing it to 2,100. We've been burning through those months. Health providers have been coming to us. I don't have the exact numbers as to what we've utilized, but we're probably about halfway there in terms of using that amount. But what's been actually very amazing and interesting has been some healthcare providers have come to us, and as they've been going through the match to come into therapy, have said, I'd rather just pay for it and leave my month for someone else, which has been amazing too, to sort of, even for the healthcare group and the first responders suffering through this, even seeing that compassion at that point has been overwhelming.
Yeah, I saw a study that non-medical hospital personnel were having in some sense, more anxiety even than the medical personnel. So I think there are a lot of people in the ecosystem that you have to think about who are working in hospitals and really close to people who are sick.
One of the things about medical professionals is that this is sort of what we're trained to do, right? You think of firefighters kind of going into the fire without necessarily experiencing that anxiety each time they have to do it. And I think medical professionals are trained to function in this kind of crisis. It doesn't mean it doesn't take a toll on them, but they are prepared psychologically to deal with these kinds of things.
I'm not. Just be totally honest, right? This is a moment that I think a lot of people are wrestling with, maybe feelings that they're not used to feeling with, or their partners. And that's actually one of the questions that came from the audience that I wanted to share with you guys. A viewer, Gautam, asked, how do I support my anxious partner in uncertain times like these? That partner, dealing with anxiety issues that, maybe become more pronounced in this moment. And I'd also just like to encourage everybody to ask more questions, and we'll do our best to surface them either in these chats or at the end.
So that's actually a great question. And we've seen a secondary wave of people coming in looking for help with relationships. It's now hard. I'm in an apartment. It's hard with family and kids and a lot of really those pressures trying to do all the things we do in a daily life. So I think one of the things that we're all doing is we're beating ourselves up. And as weeks go by, and even the healthcare workers and everyone we're putting an inordinate amount of stress, and we're trying to be, I guess, our best selves. And this is a time where it's really hard to do things the way we want. It's hard to not get upset at people. It's hard to not get angry at your kids. It's hard to focus as much as we want at work. I'd like to say I'm as efficient as I am always. I'm probably not.
Definitely not.
And I think a lot of people are going through that. And I think we need to try to figure out, how to give ourselves a bit of a break and understand that we're not always who we want to be right now. We're trying to be most of who we want to be, but especially that short temper or sometimes feeling a need to kind of withdraw can be very natural. And also cutting those around us some slack, whether it's your kids and maybe they need to watch a little more TV because they need an outlet. Maybe you need to let your significant other take a little bit of time or listen to them in a different way. And there's no regiment for this. There's no real roadmap, but I think we need to accept that they are struggling and that we are struggling, and to try to balance that.
Mimi, I'd like to kind of ask you a similar question. When you're engaging with maybe a first-time client, like what are some exercises that you offer them so that they have a toolbox that they maybe wouldn't otherwise have?
Yeah. Well, I think it's really helpful to try to first just identify what you're feeling. So I ask people to try to name their emotion, the emotion that they're experiencing. And that, while it sounds very simple, can really help focus your thoughts and calm you down and kind of at least put a name to what you're feeling. And then by naming it, you can categorize it and put it into a bucket. And then on that subject of categorizing, it's really helpful to think about worries that you can do something about versus worries that you can't do anything about. So I encourage people to sort of hit the play button and take things to their logical conclusion. So if you have a worry, well, what does that worry imply? And then where might that go? And if there are things you can do to reassure yourself or to feel more prepared, then absolutely take those measures. But if it comes up to a dead end where there's really nothing you can do about the worry, that's when it's more helpful to do a breathing exercise or maybe dissipate the worry with some exercise, some yoga, go for a walk, take a bath, do another activity that might relax you because it's a worry that's actually out of your control.
So I had one question that I got from someone who tweeted it to me, and I just wanted to throw it out there for anyone watching. You can tweet us questions live at #BW Town Hall. So as you come up with questions, feel free to throw them at us live. One question was from a provider, a mental health care provider, and asking specifically for advice for the mental health care providers working in private practice. Perhaps this is how to adapt their practice, perhaps it's how to cope. But they were asking for advice for themselves for their own sort of mental health through this period.
Yeah, it's a tough time to be a mental health provider because you're absorbing the worries of so many people. I know I've felt it personally. I've been seeing about 14 patients a day, and everybody has their own version of anxiety.
14 a day. Wow.
Yeah.
Thank you.
And
Thank you.
You feel like a sponge, kind of absorbing people's worries. So I think it is really important to have some self-care practices to set boundaries between your work and your own personal life. Because so many of us are working from home right now, that physical boundary might not exist. Maybe you're stepping into an office space, but maybe not. Maybe you're working from your dining room table. That can also blend, anxieties from let work anxieties bleed into personal life. So I think starting each day with a ritual, maybe that's some meditation or some yoga or going for a walk before and after seeing patients, can help put some boundaries on the day and not let things seep in as much. Again, self-care practices, staying tuned into what you yourself are feeling, staying informed. And altruism in itself has been shown to be an incredibly effective coping strategy. And, Neil alluded to this, that I think one of the things as providers that we're seeing right now is this outpouring of altruism. And we are thinking about the planet. We are thinking about other humans on the planet in a way that we haven't in a long time. And that in itself is, I think, quite therapeutic. And I know Brightside's just very honored to be able to serve people in this time, because it's just a time, I think, when we feel more connected to other people.
I totally I feel that way as well. And one of the things that relates to that I'm curious is, and you guys as telemedicine professionals, I'm especially interested in, how long of a moment do you think that this could become for your business model, right? Is it a flash in the pan, or do you think that this could be something that changes how we engage with healthcare professionals?
I think this is a real inflection point. I think telemedicine has been an obvious choice for mental health for so long. I myself have been practicing telepsychiatry for years and years. Was very proud to launch our telepsychiatry as well as our teletherapy program at Brightside. And this is a tailwind right now for telemedicine, because it's not just a lifestyle choice or a convenience, and it is all of those things. Right now, our lives might actually depend on it. And so I think this is going to make us reevaluate the way we communicate in general in all areas of our life. But I think particularly in medicine, it just raises the fundamental notion of, do you need an in-person visit for your complaint? And if you don't, why would you go to an in-person visit right now?
Right.
We got a question from a viewer, which is a very interesting one. And for maybe Dr. Leibowitz, you want to take this one? But this person is asking, at what point is it worth going to see someone, presumably from 6 feet away, but at least go pay a visit? Or when do you start to recognize that their symptoms of anxiety and depression that they're expressing to you are more serious, and you need to actually sort of try to intervene in a way that you might normally if you were not in social isolation circumstances?
I'm trying to sort of process the question. And is the question when point you should see?
What point in terms of if someone is expressing their concerns or their anxiety or their depression to you, at what point are the things you're hearing critical enough for you to intervene? The question is whether or not to see them, but I think more in a broader sense, when to intervene, when to say, okay, these things that you're expressing to me make me think you should actually seek help, and in what manner?
So a lot of people coming into treatment come because someone else told them to. And for men, and this is more anecdotal, a lot of men come in and I ask, why are you here? And they say, my wife told me to come. So it's not uncommon for someone to see the signs before you see the signs yourself. So that's actually a wonderful question. And I'm going to go back to what Dr. Winsberg mentioned, which is when it's really starting to take a toll, that it's affecting what you're doing in a day. Are you getting up late for work? We should all be on time for work right now. But yet for a lot of people, that's a struggle. Is that a struggle? Are you someone who is really spending your weekend in bed and that's not like you? Times have changed a little bit, but we need to adapt somewhat. And if there is a difficulty adapting and you haven't left your house in a week, right? And you're seeing someone who liked to be outdoors and they haven't left, they haven't gone for a walk. Those are the signs that tend to make me concerned and should make someone else concerned. Obviously, if it reaches a higher threshold where there's discussion of suicide, if there's sort of that hopelessness that really can be foreboding and show some of those risks, that would also be important. And I think taking an assessment or sending that person to take some sort of assessment, whether it's on a website, free, there are plenty of free tools available as well, would really be beneficial.
So I have another question, and this comes from Shreyas, and I think it's a really important one, because one benefit that I have in the middle of all this is that I can actually focus on my job and my work, which actually gives me some sense of purpose almost in the middle of all this. But a viewer, Shreyas asked, how can I deal with anxiety after losing my job due to coronavirus, right? And that feels so immediate, because for any of us who are working, we're not rooted in the same reality that someone who just lost their job because of these circumstances. Mimi, Dr. Mimi, what advice do you have for them?
Yeah, I mean, this is what I was referring to before. I think we have, much in the way that there are many people walking around with asymptomatic or pre-symptomatic COVID right now. I think there are a lot of people that have a pre-symptomatic mental health condition, and that the groundwork is being laid for a lot of mental health issues by loss of jobs, loss of meaning in life. And we don't know how this is going to manifest in the coming weeks and months. We don't know what toll this will take. So it is a very difficult situation right now if you've lost your work or don't have the same sense of meaning that you had prior to this, or if you're worried about how you're going to pay for your groceries 2 weeks from now. You know, these are very real problems. And these, as this plays itself out, we may see some emerging mental health issues that we don't know are there right now. And I think this is something that the mental health system has to be ready to address in the coming weeks and months. Risk for suicide, risk for depressive disorders, things that go beyond the immediate anxiety of the situation we're dealing with. I would back to your very specific question of how to manage this kind of anxiety. I think, again, bring it back to the things that you can control right now. So take stock of your day, think about, you know, how you can focus on things that do bring meaning. Spending time with family may be a good one to do right now. Making sure to try to eat healthy and get some fresh air and exercise each day, one way or another, if you can. And, you know, focus on the basics if that's all that you can control right now, even if you're not working.
I'll actually mention we're going to have time for one more question on this session, and then we're going to transition to our next session, and then both Mimi and Neil will come back for our last one. Cynthia, do you want to do the honors of the last question here?
Yeah, I just wanted to get a quick sense of how you guys are meeting the demand, given the availability of mental health and network providers has been a chronic issue in the U.S. Now we're faced with a surge in demand all over the country, and I just was wondering how it's working in terms of scaling up and getting the providers, the availability of providers, to meet the huge influx.
Yeah, well,
without compromising care too. Yeah,
much in the way that we've seen a big surge in demand from patients, we've also at Brightside seen a big surge in demand from providers. So providers really want the opportunity to practice telemedicine right now. They know we have our ducks in a row and have a really, you know, an excellent platform that takes into account all kinds of factors that many health groups do not have right now. So providers are flocking to us as well as patients, which is wonderful because we're able to meet this surge in demand, and we're fast tracking providers right now and hiring them quickly and getting them trained up, you know, in anticipation of an even greater surge in the coming month or two. And so that's been really, really helpful to see people coming out for that.
And likewise on our end, with the surge in demand and fast tracking, we've also been obviously paying close attention to any licensure changes, whether temporary, as a way to meet demand in various parts of the country as they come. And then the other important piece to that question was, how do we keep providers from burning out themselves? And I think Mimi answered that very well. And the other piece is we've opened up Zoom groups for our providers to talk to each other. It can be very isolating being a mental health professional, and absorbing it is very hard. And giving them an outlet to talk to each other, whether it's commiserating or sharing clinical experiences, has been very valuable to decrease that burnout.
Dr. Neil Leibowitz, Dr. Mimi Winsberg, I just want to say thank you to both of you. We're going to transition to our second session now, and you'll come back for our third. And again, just thank you for joining us right now.
Thank you.
Thanks so much.
Okay, so we're going to transition to our second session, and we're going to bring in Dr. Ken Duckworth and Dr. Christine Moutier. Cynthia, how are you thinking about this second session?
Well, both Ken and Christine work at big national organizations. And one thing when I thought about where your organizations fit in the spectrum was we started out with the people who are offering the home-based care for people who may be able to self-identify their symptoms and seek care, appropriate care through that avenue. But there are a lot of Americans whose symptoms might be more severe, and they might be looking at a situation where telehealth might not do everything for them, or there may be other circumstances or more critical situations where people need care that is really difficult to get right now. So I thought we could start there as one particular avenue. Christine, I'd love to hear about the demand or the work you guys are doing at the Suicide Foundation to understand a little bit about sort of what you're hearing from the community and what sort of need is coming there, and how this is impacting people with more severe forms of major depressive disorder or the other conditions that can lead people to become suicidal.
Sure. Thank you so much. At the American Foundation for Suicide Prevention, we are we fund research, we do advocacy on the Hill, and we have a grassroots network across all 50 states, and made up primarily of thousands of people who have been personally touched either by mental health struggle, suicide loss, or suicidal attempt, and living through that. And so it represents a very, very diverse group of people who are partnering with their local communities and listening to the need out there. And so what we're hearing a lot right now is an interest in mental health like never before. The topic of mental health is top of mind alongside this infectious disease pandemic. And that is a good thing. This is in a way kind of a historical moment that I think accrues to the culture change that's been happening over many years. That is even now in the national dialogue and across communities in that way. You know, the way that we've been taking an approach is really to stay focused as much as possible, very upstream on social connectivity, on shoring up your own and your loved ones and your colleague and coworkers' mental health and resilience, and feeling a sense of even connection and solidarity with, even though our shared experiences can be quite diverse, as you've already touched on. Some people are losing their job, other people are working at home while their kids are schooling at home. But yeah, right, many of us.
That's me.
Same here.
Yes. So, you know, I think there are many different opportunities going on, but the effective strategies, those basics that we just heard about how to keep our physical and our mental health as optimized as possible, whether or not we have a mental health condition, that all of that self-care proactive strategy applies to all of us. That's mainly what we've been focused on.
Ken, I'm really curious from your perspective. You know, there might be people who are wrestling with serious mental health issues that preceded this current moment, and now they're socially isolated. How do you go about reaching those people in this time of need?
Well, the National Alliance on Mental Illness is, of course, the largest grassroots organization of people with mental health vulnerabilities and their families in the country. And we're proud to partner with AFSP and many of the other groups that are here to be in service to this population. One of NAMI's expression is, "You are never alone." And this has never been more true, as virtually everyone now is experiencing some version of anxiety and fear. So NAMI has 650 affiliates across the nation. And so what I encourage people to do, if you have a pre-existing relationship with NAMI, contact your state affiliate or local affiliate. There are groups of people who will have family members who are quite ill and vulnerable. There are individuals who problem solved how to get 90 days of meds out of their Medicaid. There are people who've done therapy through a traditional phone, not televisits. Many Medicaids across the nation are covering old school flip phone sessions, which don't have much of a research base, but it's something. If you're in inpatient care, right, this is a tremendous challenge because historically psychiatric facilities are not well set up for infection control. What does the planning ahead mean for when you leave? And what is the safest place for you to go? So NAMI has a helpline, 1-800-950-NAMI. It has experienced a tremendous boom in people trying to problem solve. Because while this is a common problem to us all, many of these things are very individual. You have panic disorder, it's going to generate a different problem set for you than if you live with schizophrenia and you are in a homeless shelter. And so the NAMI helpline is a group of 40 peers who are staffed up to help people. Then, of course, there's also the National Crisis Text Line, which is 741-741, another great resource.
Thank you for that. Dr. Moutier, I have a question from one of our viewers, Liza, who asks, what mental health resources are there from the government? And how can our public officials be doing more to support us right now?
Ooh, those are great, great questions. Well, SAMHSA is our substance abuse and mental health government agency. So between SAMHSA, the CDC's priority on mental health and suicide prevention, as well as the National Institutes of Health and Mental Health and all of the institutes that are related, NIDA, and IAAA, which have to do with substance use and alcohol use. All of those government entities offer resources. For example, SAMHSA has one of the best treatment finder links. If somebody is not sure how to go about looking for a mental health provider during this time, or if somebody's struggling with substance abuse issues, those would be, SAMHSA and NIDA would be wonderful resources for that. And actually on our AFSP website, for people who are looking for treatment and support, we have our top treatment finder links there. You know, it's been alluded to already with this rise in the need to be able to access health service, both medical and mental health services, using other modalities than in-person visits right now. And I will applaud Congress for making the federal changes necessary to the legislation that have loosened the restrictions and allowed for telehealth services to go much wider and broader than ever before in our history. We would urge our government not to revert back to old times as soon as the coronavirus crisis is over, because I think if the analysis is done, what we'll see is that having access to effective mental health services across the board during normal periods, let alone during a period of public health crisis like now, equates to so many savings and so many positive impacts on physical health measures, on workplace productivity, our economy. All of this interrelates. And so those are some of the things that are top of mind, and I'm probably missing a whole bunch, actually. It's a good question.
Thank you. Well, just for people who are coming in late, I just wanted to say welcome to this Bloomberg Businessweek Town Hall on mental health. Dr. Moutier, I have a follow-up question that one of our viewers, Ethan, asked, and it's one that I actually am deeply interested in as well, which is, you know, we've seen suicide numbers over the last decade and change continue to rise. Is this a moment because of what we're dealing with that we're seeing any sort of additional rise in any sort of suicide numbers because of these circumstances?
That is a really important question, and one that I'm happy to address, because we don't want there to be an assumption about suicide risk right now. Because in fact, what the scientific literature tells us is that it's incredibly complicated, but that in previous periods of natural disaster, wartime, and pandemics, there have been mixed findings at both suicide rates going down in some instances, thought to be related to the natural sort of societal coming together and solidarity that in fact we see happening very much right now. Of course, we worry about those individuals who aren't able to participate in that connectedness that is so natural to so many of us right now. But anyway, all of that science tells us, and I think there's really solid agreement across the suicide prevention sort of international expertise, which I've been connected with recently, to agree that it is not a foregone conclusion that we will see suicide rates increase. And in fact, the data that we have from our wonderful colleague organizations at Crisis Text Line and the National Suicide Prevention Lifeline is that while distress in the forms of anxiety, in many cases grief, concerns about isolation and economic strain, that has not translated into an increase in the rate of suicidal crisis. And, you know, there are ways that we can mitigate and prevent it from going there, even for people who are at risk, by being community members, family members, coworkers who are encouraging and who are opening up dialogue so that people can actually share some of the burden that they're feeling. That is therapeutic in and of itself.
I'm relieved to hear that. And the idea of society sort of coming together right now, I think, is one that that I personally feel like, we open our windows at 6 p.m. and clap for healthcare workers. And I know, and in Italy, people have been singing out their windows, and it does feel like there's this moment that brings people together where I'm just checking on neighbors in a way that I wouldn't maybe otherwise. So that's great to hear that a vulnerable population is actually maybe not so vulnerable after all. Cynthia, do you have our next question for us?
Yeah, Dr. Duckworth, I wanted to ask this of you. A viewer wanted to ask you specifically, are there any online support groups run by NAMI that would work on a national level, because this viewer's local affiliate has shut down and they don't have the staffing to move the activities online? So just wondering what resources are available to someone like that.
It's an excellent question, and we're going to work to jumpstart the affiliates and their financial situation. We're running virtual walks. Almost all the NAMI walks, which are great fundraisers, had to be canceled because of what we call physical distancing. We like physical distancing and social connection, not social distancing.
Same.
So first of all, the affiliates may get jump-started either through the loans or through NAMI walks that'll be virtual and creative. The NAMI COVID-19 guide, which has 150,000 downloads, has a list of resources. Some of NAMI's programming is online. NAMI Basics is online. This is a program for parents with young children who have mental health vulnerabilities. Those downloads have exploded. NAMI's actively working to put more programming online, and we're running a webinar in a few weeks on how peers are supporting each other. So we'll be featuring people with lived experience of bipolar disorder and schizophrenia, what they're doing in their local areas or affiliates. It's an excellent question.
And I had one other question for either of you, really, about, one of the most tragic elements of this crisis being that people are losing loved ones and they are not able to have funerals, and people are grieving alone, essentially. And I was just wondering, given that's pretty unprecedented, what the sort of guidelines are for kind of managing through that for the people who find themselves in that horrifying situation.
Yeah, I can take at least a piece of that. It is just, that is, I think you've identified one of the most unusual and sort of uniquely horrifying specific issues right now related to the contagion of the virus itself, and the impact also then on the healthcare workers and other workers who are involved during those moments of either illness or as the person is passing and the family members are not able to even come in contact with them. I mean, this is unprecedented in that, at least at the scale that we're dealing with. And, I would just, this is not a simple matter. There are no simple solutions here. But I think some of the basics still apply, which are that for example, if you know someone who is in that situation, do not assume that because you haven't had that personal experience, you don't have any place in providing comfort or support, whether their loved one is sick or has passed. That grief and traumatic experience that they're experiencing can be buoyed by the love and care and compassion of people around them. So never ever assume that you shouldn't, reach out to them because you don't know what to say or you don't have the language right. Just reach out, just be there for them in the same ways that you would for your community members when any type of illness or death occurs.
I think Ken, I'm going to ask one final question, and then we're going to wrap this session, and we'll transition to our open town hall with all four of our guests. Ken, I want to ask you one kind of related topic to this is drug and alcohol in a moment like this. And, just from a personal level, like alcohol is something that, I'm kind of using to cope, just to have a drink at the end of the day and be like, okay, this has been a stressful day, but what kind of numbers or calls for help are you seeing from people who are having substance abuse issues during this time?
Substance use disorder is a common co-traveler with serious mental illness. And to get back to Dr. Moutier's point earlier, the government's loosening restrictions on access to Suboxone through telehealth, which is a treatment for opiate use disorder, for methadone, which is another treatment for opiate use disorder. One of the positives we have here is that AA, NA, and Smart Recovery already had an online portfolio before this began. So I think the challenge is you have a new additional stress in your life, which is this. There may be more stress. It may be your employment situation. And I think re-upping your supports, whether that's a sponsor, whether it's someone through NAMI who understands the co-occurring nature of your life and what works for you. But I think this is a good time to inventory it. I think if you don't have this vulnerability, you know, what you described, Joel, having a beer at the end of the day, if that's never been a vulnerability for you, if your liver enzymes are fine, I don't think we have to go to prohibition during a time of stress. But I think for a lot of people, these are vulnerabilities and can be very maladaptive coping strategies. There are a lot of resources and a lot of support for people online.
Cynthia, do you have any other questions? That we still have a couple more minutes.
Just on that, I was curious if for people with substance abuse disorder, if some of this, the emergency rooms being totally now dedicated to COVID at all changes what happens for people in a sort of overdose and detox situation, where people are supposed to go, or where you might take a loved one in that situation.
Emergency rooms are quiet right now across America. So my colleagues who work in emergency rooms say, you know, where the psychiatric vulnerabilities and the detoxes are happening off camera to us. We are not seeing them. This, of course, raises all the local patchwork challenges of, do you have access to mobile crisis in your health plan or your zip code? American doesn't have a coherent national health system. It has a patchwork of benefits and opportunities depending on where you live and where you get your health plan from. So figure out, do you have mobile crisis? Because you may not want to go to the emergency room for a psychiatric vulnerability. You can be detoxed at home from things like opiates. It is not life-threatening. It can be life-threatening to detox from alcohol. So you need to work with your primary care provider. And like emergency rooms, many primary care providers are not overwhelmed right now. All the routine physicals, all the routine procedures, all the dermatologic screenings they're doing have been postponed. So your primary care doctor is in a very good position to help you think about how to manage your vulnerability with addiction, substance use disorder, or with a mental health crisis.
So we'll use this moment. We're going to bring in our previous two guests, and we'll have all six of us together. And this last session with everyone is really a chance for us to ask questions from our viewers. So if you haven't posed a question, please do so. You can tweet us at #VWTownHall. And you know, these questions are all coming from people who have been watching, who want to ask you guys questions. Cynthia, do you have one that you'd like to start us off with?
Yeah, I'm looking through the questions right now. Someone asked, what advice would you give to kids in the time of lockdown? I've heard some interesting thoughts about kids, you know, being used to being connected technologically, but this is, you know, taking a lot away from them, giving them no social interaction at all. So I'm just curious what you recommend for kids, and I guess parents and children as well, to sort of keep an eye on their mental health and also, you know, practice good mental health, get good mental health habits in this time.
Well, I can start us off because we think a lot about the parent community, and of course, kids are in different places, have different vulnerabilities depending on the age of your kids. But I'll say a couple things and then let my colleagues chime in. That as a parent, keeping your own well-being and your own mental health as grounded during this time might be the best thing you can do for the sort of secondary ripple effect on your family members, including your kids. If they see you able to laugh and connect with them and tell stories over the dinner table and check in with each other, that is extremely reassuring to the children in our lives. And I think the second thing I would say is they may have concerns about what is going on. And again, depending on the age of the child, I don't think it's necessary to overwhelm them with every latest bit on the CDC website about this, but really just respond to their questions and provide them with a lot of sense of reassurance that even though there is a lot of uncertainty right now, we are being safe as a family because we're following all of the recommendations and we're going to get through this. It really conferring a sense of optimism and hope is very helpful, of course, for all of us, but particularly for children.
And I think if you have children that already have a vulnerability, childhood OCD, or a history of trauma, the National Child Trauma Stress Network has great resources for how to think about what could be a re-traumatic experience for children.
This question comes from a viewer, Katie, who asked, assuming this increases demand for therapy, to what degree do you see cost for therapy rising? And how can those who can't afford to spend much on therapy come on top of this economic challenge?
One of the things we've tried to do at Brightside,
maybe I'll direct that one to you.
Yeah, and sorry, I jumped right in. One of the things we've tried to do at Brightside prior to this crisis was to provide an affordable, easy, and quick way for people to get both therapy online, but also access to psychiatry and psychiatric meds delivered to their doorstep. So cost, we knew, was an issue going into this because the initial session is so out of reach for so many people. And so Brightside, along with, I think, other online providers, can provide a very cost-effective way for people to get into treatment if they haven't previously had treatment, or perhaps bridge their treatment in this time when they need to get treatment from the comfort of their home.
I've also seen a lot of movement from insurers. Both we've expanded our breadth with insurers, but they've really been looking to step up and expand the ability to promote access. And they've all done a lot of work. So whereby it was probably very, very difficult to find the provider and network, it's worth trying now. So reach out, for those of you who have that ability, to your insurance provider and see if they can help you.
I have a question, and Ken, I'll go to you with this one. Is I'm a manager in the midst of this. What kind of questions should I be asking my employees as they navigate their own mental health issues?
Well, I think in general, in an employer role, you want to touch base with them, let them know you're supportive of them, but not necessarily inquire about their mental health vulnerabilities, right? If they want to that is attending to people's well-being as part of their benefit package. But I think not allowing your employees to be isolated. Connect with them, touch base with them, because some people will not necessarily be forthcoming with human connection.
I saw something that someone recommended just through their own employer about a buddy system. And I'm just throwing it out there because I thought that was a really cool idea, because sometimes, you know, you have your friendships, but there are people who might be more reserved and they might not, you might not necessarily think that you need to reach out. So it was a cool idea that one group, it was like a health group, it was a healthcare provider who were doing to make sure that everyone had someone to talk. I had a question. You talked a little bit about hoping that the government keeps these sort of more open stance towards telehealth for mental health. What about the state licensing changes that are going on that are making it possible for providers to work in different states? Because I know there's some counties in America that don't have, many counties in America that don't have availability of psychiatrists, et cetera. So I'm just wondering if there's any effort to lobby the government to, or state governments to continue to liberalize state licensing regulations going forward.
Yeah, we're seeing that happen again related to COVID, that the states that have declared a state of emergency, many of them they have translated that into lifting the usual restrictions in terms of the practice of, and particularly telehealth across state lines. And you know, I'll let my colleagues who are much more expert in the telehealth world speak to the intricacies of that. From the top line view, I would say that at AFSP, our policy team is looking for those opportunities, both at the federal and the state level, to make sure that we don't go backwards after the coronavirus pandemic ends.
It's never made. Sorry.
You go ahead. Go ahead, Neil. Apologies.
It never made a lot of sense that I, sitting in New York, can't see someone in New Jersey via telehealth, but they can come to my office and see me. So now is the inflection point to change what really has been an artifact of an earlier time, and there's been just hasn't been enough momentum to change it. We've been trying, as I'm sure many others with us here today and around the country have been trying, but as Christine said, it's really about not going back and using this as an opportunity to bring us to probably where we should have been before. And not, I don't look at it as this needs to happen because of where we are now. This should have happened probably a couple of years ago.
Mm-hmm. Now, telehealth is obviously what we have right now. And it's wonderful and helping many people in many ways. But are there any limitations? Are there any things that as a provider, maybe using the telehealth platform, it's hard to do X, Y, or Z, or the follow-up can be hard? People may say, what are the limitations to this platform that exists?
I think the sort of good practice of telemedicine is predicated on having the right tools. So there are a lot of health systems right now that are trying to piece together telehealth solutions by scotch taping things together that, it can work, for sure it can work. But if you have a great set of tools, like the ones we built at Brightside prior to this crisis, it just is a seamless process. And particularly in mental health, we're able to deliver care that's not just at par with what's happening in the community, but actually potentially care that exceeds what happens in the community, because we have built so many remote patient monitoring tools. So we know how you're doing in between visits. We know how the patients are doing in between telehealth visits, and can actually measure those changes continuously. And, having those tools at our disposal makes telehealth a very, very, very powerful tool for mental health.
So as we reach the end of our time, I just want to do a little bit of a round robin and give people an actionable piece of advice that they can take away from you and apply to their life and hopefully benefit from in this time. Ken, I'm going to start with you. What do you feel is the number one takeaway you want people to have right now?
Never worry alone. NAMI.org, the NAMI helpline, the 650 affiliates across the nation can help you problem solve your own vulnerability or someone you love.
Dr. Moutier?
Sure, and I'll gear this more towards the workplace and kind of business community, for whom maybe the topic of mental health hasn't necessarily been top of mind, although that has been changing in the last couple of years. Just remember that the brain is part of our body. And when we take care of our health, whether our lead-in is a physical health concern or a mental health concern, we're taking care of our overall health. So protecting your brain and protecting your mental health is going to actually lead to better physical health outcomes. And all of that accrues to a workplace where the culture is able to handle health issues in the most just and protective way, both for the employee as well as for the bottom line of the company. And I would just say the one takeaway in terms of actionable strategy is if you can learn to incorporate some language into your daily practices, even in the workplace, where you make it abundantly evident that you are a safe and trustworthy place and person for your staff to be able to bring up their concerns. It's not a matter of intruding on their health issues, but it's creating a platform where, should they want to discuss those with you, that they can trust that this will be a safe environment for them to do that. I think that creates the best outcomes for all involved.
Mimi, your closing thought?
Yeah, I agree so much with what Dr. Moutier said about, the brain being part of the body, and that mental health doesn't just contribute to physical health, but actually helps our immune system too. I think it's really important to underscore that right now, that having positive mental health tools will actually bolster your immune system during this time. We are happy to help at Brightside. You can take an assessment on our website. You can get care within 48 hours from the comfort of your home, be that access to medication, to a psychiatrist, to therapy tools and a therapist. So please visit our website if you or a loved one is suffering right now, and we can help.
So don't isolate. Paradoxically, this is a time when we can strengthen connections with our loved ones, with our friends, reconnect with people in our busy worlds of not calling people and not communicating. This is probably the best time to take advantage of that and build on that. And for some of you, if it gets too tough, there are therapists, whether it's us or others, who are there for when that's not enough for you.
That's great. Cynthia, do you have this? Mental health is a topic that I've encouraged you to be writing about in the magazine over the last year. Do you have a closing thought that you'd like to provide?
Well, I think one thing that's been on my mind is we've sort of already started to go through stages of trying to adjust to this and getting used to it, and then trying to figure out how long this goes and what happens next. And so, I mean, I would encourage people to continue to reach out to us with their stories, because we're still continuing to cover this, and we know that there are going to be many legs to this, and it's going to change as it prolongs. So we're here, and we want to write more about it. We want to hear from all of you. So I'd throw that out there just to say that we're not done covering this just because we've written about it so far.
Absolutely. All right. Well, to each of you, I just want to say thank you for joining this Business Week Town Hall. This is actually the first one of these we've done, but it won't be the last. We want to hear more from you about the topics that you'd like to hear about, and we look forward to doing them with greater frequency. Again, just thank you to all of you, and I'll let you get back to doing your important jobs in this very demanding moment, and just thank you for all the good work that you're doing.
Thank you.
Thank you.
Thank you for doing this. Bye now.